Nyankopon de adom yi biom yasan ehie mu wo ha se na de biarada o de dom ye no do TV consulting room ene wuni aba wo ba wa damfo Rose Aduful ene ehie mu wo ha na onim se me de bia no na ne fa kopem no nsia de ne na Nyankopon de dom ye na mene omienu no ene ehwehwe enkomo wo ha se hey na se wo ye couple na went to me wo ben Accra ha se Grant House na went to me Valentine Y Connect with Y Connect and I say Youth Connect Nidia and would you ever worry? So you're single and you may have another opportunity. I know I have already recruited somebody for next week, so that one we're going to have that show beautifully done. But it was awesome. I know so now we'll share now it is moment to share love. It is moment to just tell somebody special say Odo Onya Chrono. It is an opportunity God has granted unto us. But remember, say the greatest of that love is that which God grants to us, and He also expects say enkan yes so ye bedo do ye hosenia on rankasa edo ye no. Enti enemy me dey eye bibi sonko kra ne dey bro. Na ye kan ne say no nim say eba ne say na kwenya no nyame dodom ya e wose ne ye empensem mu ne ye di nkomo na ye ma wo so ho kwan na share experience na obi se bisa wonsem se ne ebe ya enkomodie no ebe koso ye last week mo ya de say and then so ye another level and check ye babaka ye beka nintia ene ye hye wo ha se nkuma ye bedie ene wanga meni omote se ha na minimo wo sometimes ye can say yare ni bi wo ho na wade ye se obo abrewa ana se obo akwakra na nka bia ebe ye na so wo hwe ne ena sa nsem na yeteye emra ye maya anase ye ememu ano eno ana edaso esesa anase bia bibi asesa ye behu ni nyina na ye huni enti a no mebi eko senia eko no na ye nyinara wo asebise bia no ebisa enti this is WTV consulting room ye hie mu ha se ne de ene na mene wo a che onyanyo ni o che osomo BF akegmene onyami yo ke obi yoru sedufu wo ba eko wo ba Jim Kobo, Bonafinike Oyano Kobi Moni Obi, HN Wababa back. Thank you so much. God bless you.
Well, I found a woman stronger than anyone I know. She shares my dreams. I hope that someday I'll share a home. I love you more than my hometown. Seriously? This February, the month of love, you will hear sweet words from your loved ones. But are they real? Are they genuine? Do you want a place you can have some time with friends, couples, and loved ones? Join the Y Connect team on the 8th of February 2025. If you're a couple, on the 15th of February 2025. If you are single, come to the premises of Westland Television at the Grand House located in between Delta Capital and the Holy Spirit Cathedral at Accra from 1:30 p.m. as we brainstorm on marriage issues and matters at the heart of many singles and couples. There will be a lot to drink and a whole lot to talk about. The rate is a cool 100 Ghana cedis for couples on the 8th of February and 50 Ghana cedis for singles on the 15th of February 2025. Don't miss out. It's going to be fun and lovely. For more information, call us on 0243 160 911 or 0264 820 227. See you.
Yan church Jumadia Sronko Methodist Yashe at the Airbreb, in church so ye besuya adie afa de enim efa Nyankopon Yesu Kristo honhom kronkron ene sane ye tu ye gidie mu anamo ebe pensem ye gidie no fapem yan church ye bebisa ye besuya na ye behu kan ye ho na ye nsua de ewo yan church so yan church ye ma gidie no mu ada ho pefe.
Okay, we dear Yamama Kwabas with me in ya abutere a day a chain, and a young common I vegetarian. Pempino se wosha na ebiobeka se o ase me dompe baby a dompe mienu no ehia no emu twetwon emu ye wo ya ne adeade ne ebrofo eka na se rheumatoid arthritis no eno ena ye ba behwe na enye se eno nko ye hwese nia affected the other parts of wo organ saying akoma anase bia ahrawa anase the other part of the organ near senior affected no then the ba eba na say ina obi enya rheumatoid arthritis ena afin so hwana mu no mutumi enya ena afin so obi nya bia then obeye ye hefa na obekọ ena se hwana na ebeboa no enti na ye ka ne say no unim say questions no yibisa usem ni bibebrea bisa me a menya anu yi esanse me specialist in that field near me specialist we bo the seminar e betwetwe enkomo esanse ye do ye ho bebre and nti me will find brother bi we ha say physician specialist wo rheumatology, right? Rheumatology unit. Ewo Kolibu Teaching Hospital. As a Kolibus, no much who you are not chamber be so na nidin Dr. Bernard Ofoi Tete.
Yes, please.
Dr. Bernard Ofoi Tete, or rheumatologist specialist. Is that
so
it?
I'm a physician specialist, but I'm training.
Physician specialist.
Yes.
Okay, and rheumatology.
Yes, I'm training to be a rheumatologist.
Okay,
yes.
right. Let me sure say next week we'll buy Y Connect Valentine Day now. We're training here amongst all those areas. So say and now pay and no many people who say you can't wait to win shut that NTSC because I also say but. So when you be wafe mu pen na o show no ankasa ne experience eboa e ma oti ase ye na minia baba ko oye me madam for pa no e de Ruby na Ruby na that has idea be colleague or the mate or MU the friends Methodist University, right? Great. And oye nipe bia say ye kan sa rheumatoid arthritis wafe mu pe na mpempi you know eta ene na twentwen so enti ye be pese ono so ye beti ne numu ensem abreben na den oye na oye density about it we see them surviving or living a normal life if ever there was an opportunity bia enunti e was set ne djuma twentwen so anase ne mahwe anase efie adeyo twentwen so obeka ni nyinara akyere enti Dr. Bernard enina ye mamo akwaba ewo consulting room your discussion no ye a blend of it's mostly in local language meaning say a daughter for the unya nyoma several for no mukeni enti mama minim and every person be sabi what enti that I say over there as a guy of a kakaka chi of a kakaka right enti na ye be share see if you doctor so doctor we the yema akwaba bi say you can rheumatoid arthritis na dey and sane be can say be types be
so permit me to speak in English. So rheumatoid arthritis is an autoimmune condition. Okay, so by autoimmune, what we're trying to say is that the body's immune system, which is supposed to help fight infections, is fighting against your own self. Okay, so there are certain substances we call antibodies. Okay, so now those antibodies are supposed to be like your body's defense mechanism and fight against infections. But what happens is that these antibodies become confused and then start attacking yourself. Now, in rheumatoid arthritis, what happens is that the antibodies attack the joints predominantly, but then it can affect other parts of the body. Okay, so we're looking at the heart, the eyes, the kidneys, the lungs, anywhere can be affected. But predominantly is the joints, and then it starts in the small joints of the hands and then the feet. Then you have the large joints such as the knees, the ankles also being affected. The thing with it is that it's chronic.
Okay, just answer a bit chronic level, no.
Okay.
To me, try kakra. Na either of the languages.
Okay.
And then they
rheumatoid arthritis is yaribia with joints no. They only say your FREBB antibodies are say wow, but in that condition no, you will be different antibodies. Antibodies no affected joints no, and cause say be different inflammation. Okay, then you start feeling pain. Or don't joints start say oh yeah.
Okay. But why are they? Because say all can say amazingly not meaning say you can't about rheumatoid arthritis and also ye to say we nipedie soldiers nabi and more as a CCI was omo koma ono omo kutiao yes say ombe kwama ono omo ku etiao and then it results in this pain there. Wow. Yeah, can you say no? Can say it's not just even though a tray pains no a war and I say yeah no a war in the joints. Inti and fan say be a sa mano baby a joints would be a inti say o nine right baby a joints or na o share your nine kids one and so baby a joints or na yes home.
Yes.
Inti just baby a joints would be a inti say o share then na e be a fa skeletal bone na say sure baby a joint will be no it to me affect hono. Wow. And now in fact I can't count say and you hope now it to me affected the other organs the when you pay anymore.
Exactly.
Okay, great. Into year shana san then edeba.
Okay. So you need their edeba, but there are lots of theories I try to say one or two of these things can be a cause. One of them is that the genetic makeup of the person. Okay. Then you have certain things that are the genes. So if you have the genetic predisposition, so you have the antibodies in your system, certain things can trigger the disease developing. Okay. Now some of these triggers include infections, which mean infections. Some of the infections which mean a common cold. So viral infection can trigger these antibodies to become active. Then there's a change in the immune system, and then that leads to the antibodies attacking the joints. Another thing is smoking. Smoking has also been cigarettes. You can also have that leading to a change in the proteins in the body. Okay, so also affecting the whole system, and then leading to the antibodies attacking the joints. Okay, and sometimes stress as well.
Oh, na doctor, oh, she no man means saying poor our canon. And yet, they are far from us.
Exactly.
She senior ya brabot stress, and then me catch off it time. I'm sorry, baby, I'm a coco, and baby, I'm you know, that stress has almost become like a way of life with us now. Now, I feel what about your bobby, and no, yet me and your home. Right?
Yes.
Na I so can about the fact of as even DBT say flu. Nonsense so there's one flu or the other. And I know some of us are even recovering from one thing or the other from the flu. It means say if the genetic factor is there, now when you even common cold a bit kwako Kenya sa rheumatoid arthritis odi say you cold na onya ba wani beba so na o wedi mu ni nyinara eya emane affect other areas. That's what you try.
Yes, so in a simple terms, yes, that's what I'm trying to say.
That is what you mean. Okay. And Sana maybe say other aspects of the questions. Maybe say me who say is it you can't okay, I think that's how you were going there. Is it for a short period? Unya Ubinyani prekope enrano and I say it means what was
so it's me so like I was saying before, it's a chronic illness. So it's there for a long time, and the thing is that once you develop it, it's there for life. So one thing I must mention is that there's no cure for rheumatoid arthritis. Once you develop the condition, it's there. But then the thing is that you can go into a state of remission where the disease is quiet. You're in a bit me in a state of sleep.
As a wakoda.
That can happen. And then there are periods where it goes, it wakes up and then it causes the problems. Okay. So it's chronic, there's no cure, and it's not like you get it one time and then it disappears, as like with some other conditions.
Munya diagnosis, not just say it is like a part of the person's journey.
Yes.
It is a beye nipa no se okay, antia and I say brio, and I diagnosed so in your rheumatoid arthritis. No, does it in any case affect na brabo, the way of life? Look at it from the perspective of ejuma ebioye, and I say na worry. So your bar, senior shenema, any other areas, does it impact and I say negatively affect truncate the person's life?
So yes, so it can affect the person's life in the sense that looking at how the disease is affecting the joints. Now, if you have joint pain, joint swelling, you have stiffness in the joints, you can't use the joints. Now, if you're going to do anything with your hands, notice that your hands now become very painful, very stiff. You can't use it. So invariably, it affects the person's life negatively. But the thing with this disease is that once you control the disease, make sure that the inflammatory process that's going on is under control, the person can live a normal, healthy life. Okay. So the emphasis is on treatment. Okay. Early treatment is very important because if you don't initiate or start the treatment early, the patients now develop deformities. They have changes in their hands, which can be very destructive. And that can impact the life of the patient very negatively.
Wow, young cheating and tema it affects the person's life. And Sana called Naso for her to share her experience on that, no, especially in the aspect of say ya brabo. Emma ni emema emofra any painful. Wamonetayo ke okwe gbekebe alo onupai. Alo ye kehi nameni for female.
Indeed, it affects him more than men. So the thing is that the ratio is about 3:1. Okay, you have more females being affected than men, and usually it's in the age range of about 30 to about 45 years, and there are two peaks. It's either very early, 30 years about 45, or beyond 50 years plus. Okay. Then we can have children being affected. But in children, it's called another name. It's called juvenile idiopathic arthritis.
Juvenile
idiopathic arthritis. And usually that one is affects children less than the age of 16. Okay, so children can be affected, adults can be affected, and older adults can also be affected. But it's more common in women than in men.
Okay, enti me pese me producer de no me bi bet to dwa na ye senior ebi ho a ye kan about rheumatoid arthritis I affect your joints ne ade na ye hu ebia na you're trying to imagine senior at here, but to an extent ebia na we hu obisada anasa wan kasawa experience bisada enti emra ye de no maybe to dwa no obebo modin na wahwe amaye na but emra ye be display no me pese antina mpacho apom to say
nyame adom
na wo can say ye di nkomo some time back now can say you are a person living with rheumatoid arthritis. I just say you can unye bi ena edaso eno elko at what point or in your life, Mimi say at what age, at what point in your life, and I say how long ago and this disease was diagnosed?
Okay, so I would say a year close to a decade.
Oh, just in few do year can
wow. Wow. So close to a decade. To send a doc kind. Me wanna say media apart from genetic I don't mean to mean determined per se. Come a chemi could be some me papa could be some me mama like I was trying to find out where exactly. But near me name some mama yes sickle cell me papa so the chain and me so no work out. So I was trying to put those together. But my friend said media no stress from pregnancy.
Okay.
Okay, until my first new saying and that was, she'll be 15 now. 15 years ago, you know, to see Nyoma being in but we took it as normal. So pregnancy, yeah. So it's we any say mo Nyoma ni ade. But sure no, me wo me bano. Na fe me to me see Nyoma mpo. Me sani na no.
Like how many months, how many weeks after delivery?
We noticed after 2 months of delivery, and I mean, who say wrist. So the wrist swollen, the knuckles were all swollen, and see, I feel the men some coming to me from Tunsium. So the thing was, oh, you've used your hand to hit something during labor.
Is it possible the two hands and answer with just one hand?
No, you name no mean to me senior ma. Just because I mean sock up mona mean pager ending. But with time it went off. Say you train way way what don't sabo idea, e be a refi, e be a time and pain no woman no so I was trying to put one or two together intimidate me jai 3D. So for solid 4 years after delivery no me who she so back to normal. Until baby I normal back. And I saying second one by but second one no dear any end in a year cry. Until from day one I could see time me wo it was very, very stressful. Until symptoms ni be causes ni be a doctor kind, you know, say stress, say obenya dompe, so it was like that. And now say when you malaria, or now honam ya basa, but you na ni fa say e yin sen one dear. E chere na fe minwi etutu. Teba akese say a war heat. Teno so ye bogu ye. A tree cry a sounds of me no baby no home. But I realized, oh, my first pregnancy, no, I didn't experience this. Tiasi onye same be a different to me fanasa. And also me worry ye no. Na asayaba. So back to
wow.
The same thing. Afe in Sembisa na you should don't sabade
exactly
because we kind them they may very conscious kind them me sabade in time from somebody or but then I was home. So it was back forth and no so or call off. Then about a year later also started rest. But the normal, you were not pain pregnant again. No, I wasn't pregnant anymore. It's me for painkillers, me day, me pe bibi obema a yaw na kofum because me who bibi abium. Into me me tray gui. Na me share the way I didn't know. You to train, you to show hot, cold, you
they were not resolving.
Until ojai for some time, so for months, now my okay. Then a year later, until today it's a compound house, never pra and napa, we drew do, it's a pra. So like Monday to Sunday, it's my pra from Monday, me drew Friday, me send you I am so that was done in the normal, it's me restart for me surprise no more. I went to tell my husband, and then I didn't know I am a pow. No, say, oh, you're then. Listen, to me, surprise no more. So he took it that, oh, maybe it's because you're tired. Then he let it go. But the next morning, so I went to work. So handling the pen.
Then right, so it means that, sorry, right from if you know, now it was affecting even your responsibilities as a woman and a mother in the house.
And so I went to work, pen handling the pen, so I just maneuvered through that day. Then the next morning, I couldn't wake up from bed.
Oh.
So that was how bad it got to. So, not sure from my firstborn, no, cause time, me wo second. So in between, so that's 6 years of pain in, out, pain out. Then now a swollen body. So I woke up with right fully swollen, feet swollen, and all that. Now you were African cotton day. Obeka, I could see a judo.
I could come a
so I could judo, but a lot of people know me. So when you say, "Oh, maybe I know wait here, a judo," then people are like, "Oh, now no be a." Okay, and I don't think though you know. Oh, maybe I need to know you dancing when so you get that funny. So maybe I need to know you dancing when so it is for somebody, and I had gone through that juju or toupee or whatever it is, and it has affected my joints. It kept going back and forth. Actually, was a entire four. Aja and na mbetwetwem na wako so
this is like na at that time na ubanweza he
na at that time no na my second one no or 2 years or 2 years afina or ananto afi no tutu
and then let me go back to sorry, but na beni juma.
Me office juma. It's me wo 𝗟𝗩𝗩𝗘 sickle cell unit.
Those times no, or starting, you know.
When you also hosting of TV. So I was juggling between the two.
Right. Into those period, you know. Were you able to like manage the pain what juma now, you know, especially if we're talking about the fact that you were even hosting the program. Now it's to manage if you at least if your husband or but a juma in other sector no so
actually me no a juma manko. So for some time
it became like
it became like full ayima na me defe. So for some time, we were trying all the African interventions that we can resort to. Until we So lucky for me, me lucky because because I work in a pain management clinic.
Okay.
And see, ohobwam. Me Canada there, ohobwam because no
there. I think intermittently you'll be showing previously Dr. Naorka about one crisis Erika, the parts of the body. Rheumatoid arthritis affects into as and when you can even talk to it. Okay. So, Doctor, I think you mentioned BB today.
Yeah, so this is somebody who has advanced rheumatoid arthritis. Realize that the joints are deformed. Then you look at the knuckles, it's swollen, and then the fingers are also bent. Okay, and these deformities are fixed. There's nothing you can do about it. So most of the time, when they happen like that, you have these fixed deformities, then it affects how they actually use their hands. And these things can be very painful. And if it's not caught early, that's what it leads to.
But Doctor, when you say to say near you now, a advanced stage, you know, when you say MP, you know, say a man bar, be associating it to menopause. Oh, see, because matena sa pain baby say na menopause no man unsa chiche for balls na as a exercise so we dear you have growth and see this even features look a bit to say a younger person's hand.
Yes, so you can have in younger people as well.
Like you say, and I'll say a man is usually between the ages of 30
to 45 is common around those
and
ages.
now were you in that age group?
Yes,
okay,
I was in that age group.
Right but you talk to us from my
until I
fortunately back in there share why it looks like there's a lot of concentration on the heart. And to look at it rheumatoid arthritis, is it with the heart and as an effect on the heart? We'll look at it in that perspective. Right.
So what's in Tafuja? Fortunately in Tafun would mechi into me papa, no baby Juman or Chuchia still Uncle you know. So then we had to now go to the clinic. So like I said, baby Aname Wano or a pain management clinic, so they try to handle the pain. I remember when I was in the ward, they had to adjust me with pillows and then all that, you know, to keep my hand, because it was painful to raise the hand. So when they had to leave, because they were ready to get in vein, so I had to try and adjust in a particular way. Between when you veins, so that they can put in some pain medications. So it is one particular doctor, because now I scan, we've done Doppler, we've done X-rays and all that. There was no results, nothing found. And see, one particular doctor no kind of know. This thing is autoimmune. So let's refer. But by the time she said let's refer, now the swellings had subsided.
Like
I could move, yes, while before I could move, I could do little stuff on my own near there.
In Tiyeka about the generalized that was for about how many months, how many weeks, how many days? So
it took me 2 to 3 weeks.
On admission?
It took me 2 to 3 weeks. It was in, out, so yeah, they check on you and say, oh, I'm fine. I want to go home because I'm tired. Then 2 days I'm back with severe pain. So it's in, out, the man.
In a
so
pain, what joints in a feel pain?
My joints na me feel pain. Me lose appetite. Into me, yeah. So apart from losing appetite, I was having more headaches. A lot of headaches now there. Nah, numbness, and severe numbness, especially early in the morning. The me sorry for pim no. Minya na me to obi beka de nya nanse for 9 pim ho. In fact, I don't know how we on to me for 9 into me for 9 pim ho. Inti ebe hanging the ma kosi time or be there. Or saying sign kakra, then you make a move. And it was that kind of life.
For that long?
Yes, for that long.
Wow.
For that long.
You know, in another, because we're in the month of February, I think I would want to know, because you had 2 children.
Yes, please.
The role of your husband.
Okay.
And during that period, this is just
yes.
you know, add love to rheumatoid arthritis, which is important. And for whatever reason, we say, everything about the heart. Yes. So let's see.
Okay. So
how would it have been? How that story have been with 2 children if your husband was not really in the scene?
Okay. If my husband wasn't really in the scene, I'm coming sure they may depressed more. Depression on why? Because na me blame my own, so I was blaming my kids. I was trying to push them away because me there I was walking fine without any problem, so I felt my children were to be blamed for what was happening.
Like this remark
so but he was very, very constant with all that he kept saying, the love he was showing, the support. In Kwafu, yes, in Kwafu Buna Bim. I remember he came home with a comment like, what's it? Minimda and Kebeya day and come on wow. Because he said Misika. Wow. So it got to that point. But he was very strong. He kept encouraging me. He kept saying, "Are you bothered with house chores? I'm doing it myself." So he was washing. If he can't cook a meal, he'll come and ask questions. And you may find bad. So he was doing that. So he's a lover of fufu. He had to buy his fufu from outside because he doesn't want machine fufu or anything. And I can't do it. So, onangasa, obekwa kotoni fufu. I've eaten fufu, so don't bother yourself.
Okay.
So that was how
supportive
he was. Yes,
right.
to get me back on track. And see, oh yeah, hot water. And now every be okay. Hey, my drew and cook crab him. Do not mean sour no. Because he was doing hot water massaging, doing hot liniment massaging and all that. And he's been there, like it's
yes. So I think he's been there, like you're saying, and we are saying it for you.
Yes.
He's been there. So I'll leave the word for him.
Oh,
something sweet.
So what I would say so his name is 𝗟𝗓𝗩𝗘𝗂𝗏 and he Kobe medasa papa me fa kunya edu na makada medasa nyamisha.
Aha, actually, your Valentine alpha. Yes, so even as I want us to look at it from Dr. Picking from now the presence of Mr. Adu, support system, say Obinya rheumatoid arthritis. Have you had clients coming to the point of feeling depressed because we need abuafo, whether parents, whether partners, either way? Has support been an issue in the care of the patients with rheumatoid arthritis?
Yes, we've had a few cases where support has been an issue because what I said in the beginning, that it's chronic. So they keep coming with the issues of the joint pains and then the financial burden that they incur. So some of them can actually have, the support system can be quite challenging in the sense that some of the caregivers can get tired because then the patients now depend on them solely when they're in the state of pain, inflammation.
I think so. We'll not blame Mr. Adu too much for saying that you don't make your range, at least, or your society, the work and the match. Right.
So that can be a big challenge in the sense that when that happens, you realize that people don't support the people that have the rheumatoid arthritis. Then what happens is that they become depressed. When they become depressed, depression leads to an increase in inflammation. Then you have inflammation going on. Then you have the joint pains worsening. Okay, so it's sort of like a vicious cycle. You get depressed, your inflammation worsens, the joint pains worsen. Then you get depressed again because you're in so much pain, you can't do much for yourself. People aren't supporting you. Then inflammation goes up, depression, inflammation. So then it goes like that. So if the support system is not there to take away a little bit of the depression, to try and help reduce your inflammation, even though the drugs are also going to do the same thing, you're going to have a vicious cycle and you realize that you're given medication but it's not really working because it's a holistic treatment. Okay. So we need to tackle every point systematically.
Enti Aduful na ye kanesa no ne pese ye kanese se ebia wo ba anansa wo yuri anansa wo kunumpo e man no muta eyade we give it to them, but I know say Nancy mema na mabano so they are so wonderful. They're doing so well because he can na ninya and they even mention say ma ina eta enya. We look at even why a ma versus a mema no come to that one. Enti mistress be will be yes wapre. But men don't give up. Men ja men mawa bemu embu koswara na do koswara na support koswara na encourage. O de ebia na word ba ko power ka twene say we so would pass. Nkakwa no nyame bedom a wo boa me akọ hospital wo boa na mana num ne dro no it would be a thing of the past soon. Enti support here. Sikano ebano na ye shenkran ka ho se ne be ya bibia betime akoso yi so that we would sail through this together with love because of nyankopon ye odo enti say ye kan doctor adentina ema na eta enya rheumatoid arthritis.
Okay, so one of the reasons is that it has to do with the hormones involved. So you realize that women have more estrogen in men.
Just baby, estrogen. Estrogen. That's why you do for. Because funny enough, last I was telling some ladies say, look at estrogen. You ever be a period and then you something which is there. When the period starts, you look beautiful. Even if you don't touch anything on your face, you're fine. And then the next moment, estrogen, also. This one to estrogen is part.
So research has shown that some of the antibodies that were exposed to estrogen realized that those antibodies were not dying in a way. So estrogen sort of modifies those antibodies. So they are sort of like become superhuman antibodies in a way. Okay. So what happens is that these antibodies are the ones that are causing the problems. So if we have high estrogen, you realize that it's going to lead to a lot of these antibodies being in the system and causing the problems. So estrogen is one of the main factors that have been proposed to be the reason why women have it more than men.
Okay, now I also appreciate why you gave the age range, international. There are those in their reproductive age, definitely. Wow. But then the few on the extreme ends, who do not really have estrogen are serve as a trigger and as a catalyst to whatever they have, What
so,
called?
Like I said, it also has to do with genetics. So there are lots of things. So it's a multifactorial thing. Okay. So a lot of things are in there causing it. So it's not just your hormonal issues. It could be the genetics as well.
Yeah. And now about the fact that society and as symptoms be a deadly. Na eka se neni peduano ehonoye. Is it always the case, and I say mostly on Sunday one night no pay joints pe because say aswa, but would you mostly also see say ni peduani na ahohoana?
Okay, so there are instances it mainly affects the joints, and then you have the joint being swollen, being stiff. Okay, and sometimes you can have. If it develops certain complications, you can have parts of the body being swollen, the whole parts of the body being swollen, okay? Like, we are looking at rheumatoid arthritis on the heart in February. If you develop complications of the arthritis, in the sense that you develop cardiovascular or heart complications, you can get heart failure. Now, this heart failure can lead to swelling of the body, so the legs, the hands, the stomach, the abdomen, okay? But before I say that, there are very non-specific symptoms, meaning that the symptoms can be seen in a lot of other conditions. So sometimes you can have people developing a temperature. You can have people not being able to eat. They can have headaches. They feel generally weak, generally tired, okay? Then that would happen. Then you have them having the joint pains, and then the joint swelling, okay, the joint stiffness. Now, this joint pain and stiffness is usually worse in the mornings, because what happens in rheumatoid arthritis is that the pain that happens there is an inflammatory pain, meaning that the pain is worse when you are resting or sedentary, and it gets better when you move. So you realize that most patients will tell you that when I wake up in the morning, my pain is so bad, but once I start doing household chores, it gets better. So that's what inflammatory pain is. Okay.
O pacha say no I say wo nyehwe wo da ho you yamo.
Yes.
But we shall say oh yeah ade na say wo ko edwuma wo ne nama na reduce. But this is the case like now say the pain was limiting her abilities. Those activities could have also relieved the pain. What's them blend?
So that is where treatment also comes in. So when you put your medications that reduce the pain, you realize that the pain is bearable. Then you start moving, and the pain gets better. So people with rheumatoid arthritis always tell them that you need to move, you need to exercise. Okay. Exercise is very important because it helps reduce your inflammation as well.
Say obi rheumatoid arthritis ka say e was nipa no etumi or exercise frequently. Does it mean say patients in more a level of exercise mo treno so betumi aye anase ono ankasa any exercise be an ni hwedua betumi tolerate.
So that is also there. So we always work in conjunction with a physiotherapist or the physical therapist. Now, the exercises are tailored to the patients and what they are able to do. So depending on the joint involvement, we tailor the exercises to the patient's abilities. So we don't just say that, okay, you go and do this, go and do that. We look at the patients and what they're able to do. Okay. And once they get better and they improve, then we can increase the intensity of the exercises.
Okay. Inti Aduful say ebia afe na wabeka ye ho ana ene rheumatoid arthritis na ye hwe na enkomo no ya chichi bebre enche ye ba ye beto aso na afi be telephone lines no na wetumi bisa won sem ne ade inti e besan ba back. That's want to call out.
Something in the Bible called righteous indignation. Righteous indignation is when the prophet of God is angry with injustice. Nyamankoye, nzamandideye, ode tutuye, nsandwin wankotse wo ho. Adwin dodo no honi ye ho.
If you look into the scripture, every individual that God uses begins by encountering God himself. When the Lord touches your mouth, he touches your mouth to bless, touches your mouth so that blessing and goodness and mercy and prosperity and words of salvation will flow from your lips.
When you stand as a bishop and you speak, let the people know that wankasa Bible asem na wo kanu wakan wojidi na wone wo mo che.
Word of life, word of hope.
Well, I found a woman stronger than anyone I know. She shares my dreams. I hope that someday I'll share a home. I love you more than my hometown. Seriously? This February, the month of love, you will hear sweet words from your loved ones. But are they real? Are they genuine? Do you want a place you can have some time with friends, couples, and loved ones? Join the White Connect team on the 8th of February 2025. If you're a couple, on the 15th of February 2025. If you are single, come to the premises of Westland Television at the Grand House located in between Delta Capital and the Holy Spirit Cathedral at Accra from 1:30 p.m. as we brainstorm on marriage issues and matters at the heart of many singles and couples. There will be a lot to drink and a whole lot to talk about. The rate is a cool 100 Ghana cedis for couples on the 8th of February and 50 Ghana cedis for singles on the 15th of February 2025. Don't miss out. It's going to be fun and lovely. For more information, call us on 0243 160 911 or 0264 820 227. See you.
Aduful that was 𝗟𝗡𝗡 any wabutra with me their train ya me yakwaba na se afi no abeka ho aye rheumatoid arthritis na yenua bema Dr. 𝗟𝗓𝗡𝗘 ena yenene etwetwe nkomo ena yewo yenua ba wo haseya na edu wako satibie ni mope was sharing experience at a point who say bibisa ekoso nia who ni pedua so ansana doctor say be diagnose no say when you rheumatoid arthritis no na ye kan we nyina na ye pese o hwe ebusuafo Dr. HSM Pempi no affect emma esen emerima esan say ebetumi ayese ye body anase ebusuani mu anase bia no me bia we mu ne friend no hormones no eno ni tissue intina ata affect ye ma no esen emerima no na ye hwe we nyina no na okase in the long run kwano it may affect nipedua no other parts of the organs apart from the joints numpe no it may affect other parts of the organs to say akoma no anasa wahrawa no anasa baby biara any part of the organ will be to me affected na ene ye anasa busumi ye fibrin no almost rheumatoid arthritis ene the heart. I don't want to find out if you doctor why the heart.
So the reason why I'm choosing the heart is that with rheumatoid arthritis there's a lot of inflammation. Now when inflammation happens it increases your risk of developing cardiovascular diseases or diseases that affect the heart. Examples being heart attacks. Sometimes you can develop high blood pressure. You can develop strokes. Okay. Now the thing with rheumatoid arthritis is that once the inflammation is elevated or is high, it leads to damage of the blood vessels. So when the blood vessels are damaged, they can cause stiffening in the blood vessels and then lead to you developing the high blood pressure, which then leads to the complications that come thereafter. Now, rheumatoid arthritis is an independent risk factor for heart disease. Independent, I'm trying to say that without the traditional risk factors we're talking about is hypertension, high blood sugar, that's diabetes, high cholesterol, okay, sedentary lifestyle, where the person is not mobile. Okay. So these are the traditional risk factors. Now, in rheumatoid arthritis, you don't need to have these traditional risk factors develop heart disease. The fact that you have rheumatoid arthritis just increases, just that alone increases your risk of developing heart problems. Okay, so that is why we need to manage the rheumatoid arthritis very well and bring down the inflammation. Because if we don't do that, patients are going to come. You can have young patients coming in with strokes, coming with heart attacks, coming with high blood pressure. Okay, and they don't necessarily have high cholesterol, diabetes, and the others.
But let me just visit the issue of hypertension as a silent killer. Rheumatoid arthritis, and so it's me independently. Bibianka who be unbetting cause stroke. Nipa basically who say, and I say it is after a while of diagnosis nipa in rheumatoid arthritis and sana a heart attack possibly betumi aba and I say maybe a chance na it could occur.
So the thing is that with rheumatoid arthritis there's a period where we call pre-rheumatoid arthritis, that's like before rheumatoid arthritis, where you can have the inflammation there but you do not have the symptoms. So inside you're having the inflammatory process going on. Okay, that can happen years before you actually develop the symptoms. So you don't necessarily have to say, okay, we're diagnosing you at this point, and now we start looking at things. Some people, at the time of diagnosis, may have had a heart attack in the past, okay, which could have been from the inflammation that had been going on for a very long time before the diagnosis was made. So once we see the patients or we diagnose you, we start screening for these complications from the very get-go, okay. So we don't wait and say that we'll wait for a couple of years before we start looking out for these things. At the point of diagnosis, at the time of diagnosis, we start screening you for these complications.
Okay, right. Not yet can we say no. At the point of your diagnosis and I say symptoms now present, noma ededi wo nipedie mo no noma bi ededi a ebo hu pa apaso me na nkrofo e kasese wo na wo komo de wo he pa na ebo hu enwe yi hofo say treatments bi na wa start no ne be edwuma.
Okay, ne ebo mi hu pa on say to send you udin kind you know in my man so your menses definitely changes but na minim say be my menses I don't have issues but I feel all of a sudden no but say maybe a week before and 2 weeks before me call ya mo like to say doctor kind no pain no it to me call high na feel na kwa koda enti bon say me pain na da for close to 2-3 weeks me da so wonder so but a time be so ma why your menses now you must show because pain no to me go so higher wow to me was why really affected cause time I feel menses be trim and apart from that and also I feel me who say my husband can say I feel I'm so shock absorbed because obika asem ebe hu pena fe menya panic attack na me say mean to me control the fact say menya that sort of news you know but na enye bibia na wo me hu. Then doc spoke about hypertension. I wasn't having hypertension but a trainer I feel also a day and also coming home because they be a na me BP also.
Intina no medro for how long? And as I mean, say I don't we jai dro.
That be me down no so. To send your dog kind say a baby a lifetime way. Inti almost from yes, uchi no now we drain. Uchi now we drain because in Kofoka wakoti obi edro so wakoti nti utumi drain bisa ho say ana why na me ye ni bibi why na me ebia na obi apart from that no utumi ko say bi wa ye peka say bi a juma position ebia on preposition so bia intimate na obi akonua so obi poison me near there after say we drain say nyoma no say ma why you stressed why you depressed but doctor nya ka say way rheumatoid arthritis oboto ye mo bonya de kososo say ade a won ne betna ko say ana for ye ma show biom nti you are in between the two say bia obo ato ye m say yenya
kude
yes nti wait me I can say say nti say ya minim say we be a say but the fact say enemy betna ko si time anyankopon and kasabe frame and no ye I am share yes which is another aspect altogether my friend say be I know bia na to me accept it we no into that acceptance no difficult to come to terms with the fact say only onam na fe bibia be kan say onye na betna akosi even the normal hypertension I find say normal cry no matter say mema especially you can say hypertension be dey do so cause me
great inti I really doctor me de your contact be to job me we are not you be share about bibia na ekaye about sad disclosure so we catch any pan say ne yewuni ne etoso mienu se ene obetna afebo ne etoso miensa se de bia da obenumedro we'll come back and look at it na ya share how do you handle it as a psychologist and more refer or more to go and do that and I say it is mankasa more processes of disclosure just a quick one and just say your telephone lines need to be 025-625-3461 025-625-3461 and I say 053-835-0 0625 053 835 0625 WTV consulting room and the ear share rheumatoid arthritis and the heart and I say ne akoma na doctor ne na share ne experiences waka bebre nti say share no mo yawo and etumi affect ni pedue ni nyinara enrechi no so etumi be ade a eno etna afebo doctor disclosure.
So when it comes to disclosure, we tend to tell the patients what it is, okay, how long they're going to be on medications for, and the fact that they need to be compliant, which means that they need to take their medications every day, because you need an amount of the drug in your system to try and control the antibodies. Now, some patients, it's difficult coming to terms with chronic illnesses, so we tend to sometimes refer them to the clinical psychologist, but nonetheless.
That's compacho me enkof ma yenko teshi emra na hello Auntie Mercy. Yes mama me pacho latebi okoshi for hon to say. Pacho yetio yeah that's say wa friend of TV consulting room. Pacho
na mo ka me TV na me tie e bi ye me pa na ni ti sitting and cafe. You know, I'm person disabled, and so, and we think
okay. Mama, Mama, now what can say? What hospital? I'm a doctor. I diagnose us. I'm not. Okay, may that say right. Thank you, Dr. Becca Hansen. Hello, Antina. Oh, hello, Babana.
Hello.
Yes, Eja.
Hello.
Yes, Papa. Oh, fine. Take colleague gonna be your thing.
And colleague gonna be your deba.
One double shake or chow. Fine, one bobotoy.
Oh, fine. If I say my baby. I mean, the Lana US and the check before the banner, I war here, no, but only for people who were affected.
Okay, about oh, chichi. Okay, right. Oh, fine, you. Sure, oh, fine, one no shishin. Oh, fine, you. Thank you. She, fine, a boy here, woman, be
Oh, for there.
A boy here, woman, Buffet be
I want to check. Can you help me cry? If I need nothing more, I see.
Tomafi. Oh, fine, last one. Afi, afi, no wait, is 30 years. Okay, oh fine, you okay. Oh fine, you are done. He was Dr. Bahabo Hito. Hello.
Hello.
Yes, Papa Mustafa Mpacho Adabraka for who to say.
Papa for yes.
Pacho
okay. Miso Nano rheumatoid arthritis.
Okay.
For 8 years now.
Amazing.
And easy at all. Even though I do sometimes, I nearly lost my life. But now the back clinic for 𝗟𝗓𝗪.
Okay.
𝗟𝗓𝗪 rheumatoid arthritis. Yeah, the back clinic for. Okay, so I'm trying to manage, you know. But in Bruno, so I don't know a problem in my minister. In Bruno, so you know, I don't see a high for me. And I do that, no. But this time, I mean, I go through exercise now, like how so, but it comes on and off. But it wasn't like before, you know. Before the year, like me to me 90%, like even some steps, yeah. Into sickness beer, at least we should able to control our diet. Yeah. because soon to me, it comes in a different way. Yeah, so I think mid-year program is also nice because I don't say this month I try this month because
exactly.
Yeah, PHT and other programs go at the stations.
Okay.
Yeah.
Right.
Okay. In the other way, more review next. Yeah, that's true. Yeah.
Intimate thank you so much. Okay, right. Thank you very much. Okay, yeah, that's it. Okay, right. Hello, Mr. Boama. Okay, Auntie Esther. Yes, Mama. Mama, I'm passionate to you.
I told you now, like education, one of because many say me won't for
Mama, patron, no TV, no volume, kakra, mame. Patron, make us a lower TV, no volume, mame.
Okay.
Yeah, that's it.
And people my baby, I share me had I mean for Kolebu because that we say to me check clinic. Then you know almost say and yet she the man can't put me bread. And she could do say you say actually a son taking me some years back and I striking with you. That you know people say I have I really easy because they said me will be a camera source for me. Yes, for there. If you say I can make to work more than you cannot into me sorry free bed. This I really is that I said more a passing more medication because obi baby obeka so obi na you busy there. Now you will be so and a house because. Yeah, this habit near me bear. I told me, Mamma will say, no, you power away. You have it near your bed. The way you know, be a man and sure say, I did say, well, your doctor, man, and just I did say, why do you also be near you, be so you're in a house?
Yeah, no, okay. Yeah, that's
me. But the person is say, that is one of my best near why I what problem.
Okay, inti Dr. 𝗟𝗂𝗂𝗃 obema ehomwaye ye ko oboase abana yakofa 𝗟𝗜𝗩𝗘. Hello uncle say.
Yes madam.
Hello I just say mpacho good evening. Boase for who to say.
Boase for ye pa.
Yeah, that's say our friend mpacho yeti.
Nene say ma it program.
Thank you.
Na asase ene be maka abedi na I said my wife was a problem. Since me na minya joint pain severe one toda or year week. It's minya heavy headache. It's trying to walk of hospital. But among me diagnosed who say yes rheumatoid arthritis ya okay. Inyan who say but you mostly na chisibia. It's problem you before.
Me pacho Dr. Tete bedomie na right. Thank you so much. Indeed, Doctor, I think say you bet me mama nuyi so far.
Okay.
Asanya for next.
So so we'll start with the last one. So he's saying his wife has the same symptoms. I mean the best is to yes. So the best is to go to a health facility, okay? Because the thing with rheumatoid arthritis is that it can present like other disease conditions. So you'd be made to do some investigations which would actually confirm their disease and then treatment can be started. So the best advice is to go to the hospital, okay, to see a doctor. Now, the one who spoke about the...
Mean fat comfort and countless in the whole na yeah, hello, Mankoni.
Hello.
Auntie Comfort, I'm patch outside if you want to them.
My patch, my cousin fee and Takrade.
My patch, Takrade if you want to them.
Rather not do young way, pa.
Yeah, they're right.
And then the first time I mentioned a program way. Rather not do one way.
Mama Pacho, my TV no volume on down. Maintain me what TV no do. Aye, adze. Yeteo.
Pacho melo.
Aye, adze papa yeteo. Amen kasa today wo phone do.
We treat the also arthritis, sir. Maybe said we treat the also.
Arthritis, but Pacho also you do orthopedic food also baba. Ate. Okay. Yeah, that's it. Right. Inti tashe hen. Me made the piano 9 of couple nunsia. Ate. Let me show, please. Okay. Mama Vera. Hello, Mama Vera.
Madam.
Yes, Mama.
Yes, I go.
O fine ya ye. Wanda boshi akeshi ochawo wombo botoi.
O fine Doctor Angbe choni ye.
Imo fine e kolebu.
In sister ye. Okay, you sister ye na kan program me ko wa de nche. Ne Boninye sha ewa BFC na kan sister no ni e dey almost 25 years ni.
Okay.
What treat she ba ko wo mo ba na wala kan no ni. Ni Boni doctor we anopale ame tomo wa ame edaize. No, okay, colleague, you be careful. You have been over try to come here. Keep over and be an amount.
You find you. You will find in your banyan ya hospital for any bank Kenya. Eke ahame referral owner. Beke ahanya wulu benye ba kolebu amejeme ba mekwele onulo. Dr. Benakan. Okay, right. You find it. Oh, you rather I can show you. So please, you can answer the rest of it.
So the other one talking about the chest pain. So now in rheumatoid arthritis, you can have inflammation around the covering of the lungs. Okay, and then when they're breathing, they have pain as well. And sometimes, like I said, it affects in the heart. You can get inflammation around the vessels that supply, or the blood vessels that supply the heart as well. And that can also lead to pain, especially when you try and do something vigorous or try and do an activity, you start feeling pain in the chest. So ideally, they should come to hospital once again, because they'll have to have some labs done to try and find out exactly what is causing the chest pain. Okay, so it all has to do with coming to the hospital to be seen. Okay, now for the person that spoke about the diet, now the diet is also very important, because there are some diets that have pro-inflammatory in the sense that they increase your inflammation. Okay, examples of some of these diets, you're looking at diets that red meats. Okay, excessive consumption or eating of red meats can lead to an increase in your inflammatory process. So we try and reduce the quantity of red meat intake. Then there are certain seeds, sometimes nuts can reduce inflammation. Foods that contain vitamin D, vitamin C also reduce inflammation. Okay, then turmeric powder, ginger, all those things can decrease inflammation as well. Then I spoke about smoking as a cause of
a contributing
factor. Now the thing is that you don't have to smoke personally, but the fact that you're in a community where somebody is smoking, so that's secondary smoking.
Because that is the unfortunate thing. Say a lot of even the friend is saying, stands here, whether it is a restaurant, it is in some areas when in baby about doesn't mean we are not going to the proper places anyway. That's by the way. But I think say you look at the fact say obi ena enum ni cigarette onum ni shisha onum ni onum ena also concern ka oko dije anase mokotna hono na mabonkomo na mabefie. How do you control these factors?
So these things, I must say, they're difficult to control, but then there are some places that have a strict no smoking policy, okay, and ideally some places who don't allow smoking indoors. So if you want to go to some of these places, you can try and visit those places and then patronize the indoor places. Now in terms of in the exposed areas. You know the places where people smoke. You know the places where smoking is high. You wouldn't want to find yourself in those spaces if you have rheumatoid arthritis, because it's going to cause a flare or it's going to worsen your condition. So in as much as possible, if you don't smoke, don't be in a space where you find yourself with people that smoke and then you become a secondary smoker. Okay.
I know cry worse.
Yes, it can actually worsen.
Right. Inti Aduful, doctor, I can't be brave about near yet and I said some ye Aduful ni ebisano na obi kura kase munyan diagnose na so when you're rheumatoid arthritis. Does it mean say kusiseni pan be present all the possible symptoms no? Eche answer na ma diagnose, because Nadia ni say Alicia fan say Nadia no is a decade ago about in few duni intina enono ishishimu ekoso. Is there a way ebi ashase na some few months mbe so we dey a feature na send your day bano rheumatoid arthritis na mo treat ma diagnose in term? How was the process, the diagnosis now?
So in the diagnosis, like the patient would come with the history of the joint pains, joint swelling, okay. Now, typically we use a cutoff in terms of the duration. So you typically use 6 weeks. So anybody that has had joint pains for more than 6 weeks, that is a red flag, or that is a suspicious thing that we need to look at. Because there are lots of...
Then it means uncle, wife, your free or boss, I say we are doing them a lot of disservice. Because I say ache over a year, or more kobasa, but in young campus when you're rheumatoid arthritis, or not in person, what should they do?
So with them, and I mean, the thing is that a lot of people aren't aware of the disease condition. So that is why we are creating awareness to realize that, okay, they need to know that there's a condition that's rheumatoid arthritis that can present with joint pains. And most people would go in and out of hospital and tell them, oh, it's malaria, it's typhoid, it's something else. So if they are aware of a condition like that, they'll then now do the investigation or the tests that would actually confirm it. And now the history is also very important. Like I said, duration more than 6 weeks, joint pains that comes and goes, joint swelling, hands, feet, okay, the knees, all these things, you need to put it into context, okay. Then once they present with these symptoms, you examine them. So when you examine the patients, you realize that they'll have swelling of the joints, okay, in the knuckles, the small joints of the hands, the knees, the toes. Once you have these features, then you go ahead and then you want to do your investigations. So there are certain blood tests that we will do, certain x-rays we'll do of the joints, the hands, the knees, all the other joints. We'll look at it. Then once we do these tests, there are certain specific tests that are very specific to rheumatoid arthritis, okay? So we test for some of these antibodies to actually help confirm. But then there are a few patients that may not have these antibodies being present. Okay. But that doesn't mean that they don't have rheumatoid arthritis, because there's an entity we call seronegative. Seronegative just means that they don't have the antibodies, but they're presenting with features of rheumatoid arthritis. We will manage them just like those who have the antibodies. Okay.
Inti bimu wa like moye test na bibia entry, but near friends near dead, you know, is to say rheumatoid arthritis. In that case, more money panidro to say obia moye and test no entry. Yes. I think that would help, because yes,
I'm the seronegative.
Oh. No, yeah, I said being in the middle. Does it be a wise now? Cancer, Sicado, what 10%?
Yeah, positive. Oh no, why test my home?
Exactly.
So that on my maker there, on my binum doubting. A bit doubt exactly. Because why you test nini no? What's a name? So, what catch out there, or you 2 types, or you seronegative, not at all, would they not they won't, but all day. And so we call it something invincible, because seropositive there, so your labs are there, you see it's there, but seronegative for no. Yeah, you're more dangerous, because we your labs all the time. Our labs are fine.
Now, into there, looking at you. and then having lived all this while with the rheumatoid arthritis for 10 years, in that sisi anyamanadom, even there's a lot of improvement because make you know ye do come and make at the point like you was sister your friend now one sanka why you do that now was hosting you for some show you know I learned a lot for her we teach her more show me I say me be so there like currently are you fully doing your normal day with Jumari ibusuya share and my biara na more are you fully able to manage everything now and another so there are some
you maybe one me trim who free home they be a may a long standing kitchen and the metre me juma abu bomedo me into me a majuma pair my pace improvement, yes, improvement about the enduro one, but yeah, me to me constant. Me come no crowd because a cow wo, and me to me constant wo enduro do. Me kai do be do time me po me go in free cause na me nko. And see me doctors no crow too much stubborn academy. Ozane my bread me sika me spend every month na ebe call clinic no so because of injury na woman nti and na yare ba nan kasanti we check kidneys we check liver we check inti ni na watro doctor on hand of ala form no to no tick me dey
rheumatoid arthritis or health insurance no do. Because yes, this man now came as part of not just physical support. In his obeisance, they will some in them holistic care no or health insurance.
So I must say that most of the medications are not on insurance, so they have to buy it out of pocket.
Indeed, when my clients and my viewers, what's my point? Or your campaign, the woman was in a one corner a ban, now one for being to insurance to do my hand. That's it, right? See, last night pediatrician sana ya call when a prevention is it preventable? So you between me see no quan.
So the thing is that rheumatoid arthritis is not preventable. Because the thing has to do with your genetics. So once you have the predisposition, you can't prevent it. But what we can do is that we can manage it to try and prevent the complications from developing. Okay, so once we catch it early, put you on medications, and you stick to the regimen that has been provided, you should live a normal, healthy life. But it can't be prevented, and it can't be cured as well.
Okay, but you try to help the person to live.
Try and manage. Yes.
Okay, and managing it when we live in a normal healthy life. Now you will as a Korea pedebaka.
As a American, the messer. Now to the American, although you be pushed down buying in your baby, my year medications, na don't know, neboyezen pa. So most of them are coming from dollar affected or be affected. COVID cost COVID the year you know or we shoot skyrocket and as I best say the pharmaceutical companies na the journal will contact medical Kolebo medical will be to one year doctors and liaise na injury will be to my support all my 2 boxes 3 boxes will be very very grateful and momo na ma menyem se metum
but now association
yes
okay
so we have a patient support group so that's where we derive our strength from share meetings me fan there nyina kauna Mikun so to me jina mechi the other family members that are living with people who have rheumatoid arthritis no they wo to me ba meetings nibi na wo church and ade into what train most are able to me live a normal life it's also boy pa support group no na ma yede support ye ho kakra here near the years yede train sika kakra near yede hwe ye ho nti yede boa other patients bia obi wo ha menyim na doc nyim na ebi num da dialysis do na denti onye na no yede boa ye ho.
Okay, into my ads, baby, Dr. Bernard 𝗟𝗓𝗘 from a friend and physician specialist there at the rheumatology unit, Kolibu. Exactly where?
So we're on the medical block. So the medical block on the third floor. Or the medical block.
Third floor. Medical block. No, Doctor, you want to be there. Nema bani na batushon komo. Ena antina
pede support the patients of with rheumatoid arthritis. Yemomo number is 0241 929 775 0241 929-775
929-775.
Epede bisa sem de doctor akase wie pede ewie enquiries more ono so ye one number betuma afre ono ye 0544 089 065 0544 089 065.
Yeah, that's a baby. Inti asafu mami gifty pobi. Nyami show baby. Now oda bitume kan kramuke bibia. So the way Dr. Fwe no kram made you first. Why but in fact my that's a very deep knowledge. We na inyanara be share. And so I think said the misconception, like I was saying, another myths no they in there in there menopausal changes na. You know, I know there are psyche will change to support and then do the appropriate referral. And I plead with young other facilities, no, my training baby because 1 year I should be an assault the man. Let's look at referring to the highest level or at least all my patients no so cran na kuma 20 years. Mpocho se Kolibu we are friendly. Kolibu we are world on its own, but I'm sure the doctors were medical third floor into Bomazina age referral and name the local medical streets no sure depending on your condition. Mpocho maintenance fee. The pede nyankopon pede inya nkwa na honzena etum asumni ye na inyara yetum ya dono. So thank you so much, baby Biara Obiara Mama gift once again. Yes, I love you. And now Obiara baby Obiara Biano. But don't want to be brave. The Busumi or a month of love. But not just love to your partner. Love that particular child. Na Ibia or here a little support to go to school. Another here a little support for medication. And now any kind of support be a gesture of love will put a smile on the face of someone. So let us continue to love as God loves us. Na yembo modena de besunyankopon ye. Meda wana say, thank you. God richly bless you. It's a miss Mumbuzina anime Jubi. It's a net Mumuzin waka just a second. So you know we are so grateful. You are the reason for this show, WTV Consulting Room. Deberada, no none fa memneda yeba hade ni yun wichum komo. Yami aduma next week yeversan yaba or the chehena in Timo Pocho. Yentado ninshiaze na yankodara yansom yankopon onyankopon onshodo omohuban non tunenim chiro. God bless you so much. Amen. Bye bye. I love you.